Hello, we're here with Dr. Erin True, the amazing vet in East Sac. She's going to answer some of our most wanted questions, and let's get started. Tell us about kennel cough. Is there a cure?
Basically, what kennel cough is it's the same thing that we talk about when we say I have a cold. Kennel cough describes a syndrome. It doesn't necessarily describe a specific illness. It can be caused by a lot of different things. So it's just kind of like when I say, oh, I've got the summer cold or I've got the winter cold. Basically, that's what we're talking about, is some type of upper respiratory infection that can cause coughing, sneezing, runny eyes, very similar to us having a cold.
But if you give your dog bordetella, then they're totally safe, right?
Right. That's like you and I getting the flu shot. When we go and get the flu shot, they make a guess every year as to what the most likely strain is in the flu shot, and that's what they put in it. And it's why you'll often hear people say, oh, I get the flu every time I get a flu shot, or people say, oh, I always get the flu shot because I never get the flu. Bordetella is the same way. When you get the bordetella vaccine, you are protected against what is in that vaccine, but it is by far not the only thing that causes the syndrome of having a cold, which we term kennel cough in dogs.
Why would you even get a bordetella if it can't protect you from...
So it's just like getting the flu vaccine. If you can protect yourself against something, you should. Bordetella is the most common cause of upper respiratory infections in dogs. And so it makes sense to get it because that way you are protected against something that is one of the most likely causes of the kennel cough syndrome, but it's by no means the only thing.
I have more than one dog, and one of my dogs gets kennel cough and the other one doesn't. How is that possible?
So speaking personally, I have 4 dogs, and we just had kennel cough go through everyone. And 2 of my dogs got kennel cough, and 2 of them did not. And generally, it's kind of like it is with people. Depends on your immune system. Here in the hospital, when someone walks in with a cold, all of us are immediately in fear that we're going to be the ones that get it. Some people get it, some people don't, just depending on what your immune system does with that individual organism. And so it's the same thing with dogs. Some dogs who have had kennel cough when they were younger will get to the point in their life where maybe they're not nearly as susceptible to it and they don't get it. My 9-year-old dog and my 6-year-old dog were the ones who did not get the kennel cough. And my dog who was 12 months old and 2 years old did.
Some people don't take their dog to the vet when it has kennel cough, and some do. And I mean, how do you make the call? How will the average person say, yes, I should take my dog, or just tough it out?
The kennel cough is a really dramatic cough. It sounds like whooping cough in kids, where it's this, often we'll actually have people present their dog for vomiting, because what happens is they cough so hard that they do what we call a terminal retch at the end, where they cough, 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 and then at the end they kind of yak up a little bit of white foam or mucus or whatnot. And that alone can be enough to really make the dog distressed. They don't want to eat, you know, that type of thing. It's kind of like us with a bad cold. You're not going to die, but you feel like you might. Mm-hmm. But there's a very small percentage of dogs who will actually develop some secondary bacterial infections from kennel cough, and those can be more severe and do need antibiotics. The vast majority of kennel cough cases are just like the human cold. Your doctor wouldn't give you antibiotics for the cold. We won't give you antibiotics for kennel cough either. But the determination, if you have a dog who appears to be running a fever, who is refusing to eat, who appears actively lethargic, most of these guys are coughing their heads off, and yet you pick up the ball or you pick up the leash, they're ready to play, their appetite is minimally affected, their whole attitude is minimally affected other than the cough. So if you have a dog who exhibits signs that are atypical for that, we would definitely recommend going to the veterinarian. Otherwise, it tends to be something that runs its course over the next 7 to 10 days. But if you have a dog who's unable to sleep at night, or you're unable to sleep at night because the coughing is so bad, then frequently we will see them and prescribe cough suppressants.
Do you recommend that we just give our pets cough syrup or ibuprofen?
So most human medications that are set up for us are not set up to be used by dogs. They have a very different metabolism than we do. Their liver and their kidneys metabolize drugs differently. So often human medication, even cough suppressants, can include a variety of different medications in one cough suppressant. So whereas when we provide a cough suppressant for a dog, it comes in tablet form and contains only one thing, Often if you go and you get Robitussin or you get medications made for people, they include a decongestant, a cough suppressant, something to loosen up mucus, and those other ancillary medications may not be safe for your dog. So usually we recommend, if we're looking at giving any kind of medication, to bring them in.
Can I just say, at one of those time frames, at 7 days or 10 days, this dog is cured?
That's the hard part, is it's knowing when each individual stops being infectious. The really bad part about kennel cough or any infectious disease is the fact that most of the time, from the day you see symptoms, you can assume that 2 days prior to that, your dog was infectious and spreading it to everyone else, which is why it's such an easy disease to spread. Because for all you know, the dog who was walking at the park yesterday, your neighbor's dog who came over to the fence to greet your dog, was exposed to kennel cough but wasn't coughing yet. And so the idea that we're going to know exactly when they're no longer infectious and can't spread to anyone else past that time is going to vary per individual. What we generally say is, once the dog is no longer symptomatic, or you don't have a dog that is actively coughing and retching up foam, and you've gone at least 24 hours from that dog's coughing, generally you can assume that dog is no longer infectious. There are some dogs who get that, it's like us, where we'll have a cold and then we might cough for 4 weeks even though we've long since stopped being infectious. For the average dog, if you've made it 2 weeks and you have the occasional cough, that dog is probably very safe and non-infectious at that point. It's actually kind of a funny thing, because when we all take our children to daycare or to birthday parties, and we drop our child off at daycare and we see all of his friends come running over and all those children are sneezing and they have stuff running out their nose, we all kind of shrug our shoulders and we go, oh yeah, that's what happens when they're in daycare. And honestly, kennel cough is very similar, because it is a cold and it's caused by so many different organisms that the ability to prevent it is really impossible no matter where you are. It's not an indication that any place isn't following good sanitation protocols. It's simply a function of any large group of people or large group of animals that get together on a regular basis will expose each other to their infectious diseases. And when it comes to kennel cough, here at the hospital we have kennel cough. All of the doctor's personal dogs within the last month all got kennel cough. Half of us had vaccinated our dogs for kennel cough, half of us hadn't. The vaccinated half got kennel cough every bit as badly as the unvaccinated half. And it's no more serious most of the time than us getting a cold, unless there's some other predisposing factor that causes that animal to develop secondary infections. So it's not a case of, can't we just clean better? Can't we just prevent this somehow? It falls in the category of similar infections in humans that simply aren't preventable, other than by never interacting with another dog.